abayi no yebetimi ehu se dia enyema etimi akwa akoduro na yehu se dia yebetu yanamon ewo oman emu na enam so ma Dr. Kuma Aboagye a woye pani titineni edema Health Ministry no ede beto abonten ese hu behia ese nhwehwemu a wono aye no ewo se apemfo so etimi ewo COVID-19 vaccine yi ebi na ochiremu eka se enye se ebi a enuro na abanana jazz ni nyina no wontimi enwo bi na emum dia wono efil se ebeboa se apemfo no ebewo eye Moderna ene Pfizer enu echi no ode tudwa ese sesei na wodi kan eka se nipa anase emofra wadi mfihye dunwotwe ene betimi awo bensu sesei no nhwehwemu adadi ama won mahu ese wotimi eteso eba fom ebedu mfihye dunum enti obi a wadi mfihye dunum bia no wono soso ebetimi awo panie no ebi enu achi so ode tudwa me enya ho ntiase ese wose ye peda esi hono ne ye de kai COVID-19 eye yade no a ebema yeni ada ye ho so na ye hu se de betu ya namon ewo omayi mu ede afa ede fatichu fourth waves aba kunkum na yentena se emefa yen kra ansana yede entutuye bi egu akwam yenko enkotie ensem a wode etudwa.
We'll just give a brief of further details of what the minister has summarized. We will talk about the overview of the current situation, the epidemiological situation of COVID in Ghana, vaccine updates, admissions of COVID-19 cases, and there are key policies that will give further details to you. What is our current situation? We are currently experiencing our fourth wave, and I believe that we've seen a sharp decline, and we hope that to continue like that. The proportion of critical cases are relatively low, even though this is the highest wave we've ever had, with the largest number of people getting infected, but hospitalization and number of deaths are significantly low. All regions have active cases as we speak, unlike what we had in November. We have seen a significant reduction in the active cases in the last 1 week as the new cases slow down and those who are recovering are increasing. The cases among international arrivals are on downward trend, but even though this is the season that we have the highest number of people testing positive at the airport, sometimes as high as 160 cases. The latest one was about 40, which was yesterday. So that's even, if this happened 3 months ago, would have been a record. But there's also a downward trend on the cases, and the positivity has slightly increased, which means the proportion of people who are testing positive have increased in this current wave. We have so far confirmed 155,242 cases. We've done 2.207 tests with an overall positivity rate of 7%. The total recovery is about 149,623. We have so far recorded 1,364 deaths, even though this last year our ascension was the highest in terms of number of cases. We also experienced the lowest number of deaths compared to the other 3 waves earlier reported. Currently, we have 40 severe cases and 11 are critical. And I must add here that, yes, we are talking about Omicron, but we still have some Delta in the system. So if you look at the next chart, it is the four waves we have. The last one you can see is the highest peak in terms of the number of cases reported on daily basis. And this one was not preceded by the minor wave as usual. So that tells you the significance of this current wave that we are just slowly getting out of. If you look at the next chart, the next graph, you see that the same picture of active cases, and more cases are reported in Accra, Kumasi, and in the more urbanized regions. That's where we have the highest number of cases. We saw a very significant steep a steep rise, next slide, in our active cases, reaching nearly 14,000. But as we speak today, we are just about 6,000 and I think in 20. And so you can see a sharp increase and a sharp decline as expected. And I must say that our active cases variations are going to change based on the new knowledge about active cases. So that means that the recovery time may also start being more sharper than it is as we revert from the old 14 days to a new de-isolation period that we'll talk about. So far, we have tested around 51,000, almost around 52,000 arrivals at the airport, with 6,696 positives, with us a positivity rate of 0.89%. But the latest version, the latest phase, the positivity was much higher. It was crossed 10% and plus. About 41% are female, 49 males, and vaccinated about 80%, and not vaccinated 20%. If you look at the trends, you can see that each wave is also analogous to the wave we have in the country, but you can see that the last wave was very, very, very huge, and had it not been some of the measures that were put in place, I think our peak would have been much higher than we currently experience, and it would have been more prolonged than we had now. So at the airport, you can see that in December 2021, we reported 2,383 positives at the airport, compared to the same year in the same December 2020, which was only 393. In January, we have recorded already 1,184. So the airport has increased actually the number of cases. This is the first time that in the monthly aggregation, the second highest cause of positivity after Greater Accra was not Ashanti, but this time with the airport. So which means that if you add the airport to the Accra cases, you can imagine the number of cases produced already alone in Accra. So these are the daily cases at the airport. As you can see, peak and then it started coming down. Now 39 was the latest report. And as I mentioned, the positivity at the airport also saw a very steep rise in this season. That tells you that the proportion of people coming in who are positive was much higher than we have actually seen. I will later on come to the case studies and make a case for vaccination, but let's talk more about the vaccination now. So far, we have received a little over 25 million doses of vaccine. We have distributed about almost 15 million already, and we have currently in stock about 10.5 million doses in stock. The COVAX has contributed 68%. Government of Ghana's purchased about nearly 21% plus, and we have had some bilateral donations accounting to about 10% of the donation. We want to use the opportunity to thank our partners for the support. We are expecting about 1.5 million doses very soon. The date is yet to be announced, and then we also allow. This is in addition to the doses that we have had to hold up so that we can bring them in tranches, not to overwhelm our cold chain facility. So far, 34.8% of the population have received at least one dose, and a little over 16% having been fully vaccinated. The 34.8% is in relation to the targeted 20 million people to be vaccinated. December, the minister declared a month of vaccination, and in that December month, had it not been the Christmas festivity that curtailed the distribution, but we were able to do about 2.9 million, nearly 3 million doses of vaccine were distributed in December, with the first 3 weeks of December. So far in January, as at today, we've done about 1,040,000. We are mentioning the numbers that have been keyed into the system. It is not all the time that the villages are able to enter all the data into the electronic system based on network, and so as and when they get network, they update and the numbers. So you can see 1,040 today. If tomorrow we see 1 million, 1.5 million, don't be surprised that there are somebody's manipulating the figure. It is because people have been able to key in the data. We started vaccination of schools way back in December. It was, that is 15 years and above. Most of them were in secondary schools. We've so far done 244,307. It was curtailed first because the students started their examination as soon as we started, and then of course they went on holidays. Now those who have resumed, we'll continue vaccinating them, and we'll keep on giving you update on the number so far vaccinated. On the regional distribution, you can see that Greater Accra has had about 44.5%. They are the highest of the population that have received at least a dose, and with about 24%, 24.3% fully vaccinated. This is followed by, I think, is Bono region with about 43% vaccinated with one dose, and about 19.5% fully vaccinated. Ashanti also comes up with about 42% first dose and 16.6% fully vaccinated. Very soon, as we said, we are, the booster dose have been mentioned, but I'll give further details on it as we go forward. And then we are also planning a national immunization date for the nation, where there will be 5 days of intensive campaign and vaccination. We need time to do social mobilization, mobilize people, and we are expecting, with the help of the media, more people will know and people will make themselves available to take up this opportunity to vaccinate as many people as possible. I think as we are aware, we've always had some challenges with people are talking about vaccine and effectiveness. And we have always mentioned that the vaccine effectiveness are on 3 levels: getting infected, and also falling sick, and of course dying. Our largest center for COVID is GIDC, so we use that as a measure of some of these things. They run a general outpatient just for COVID out there. And in the period between the 4th July and the 14th of July, they saw about 900 COVID cases were seen at the outpatients. The total unvaccinated was 529, which is about 58.8%. Those partially vaccinated were 10%, and we had 30%, which is about 273 fully vaccinated. But let's look at the next slide. Of the total number who were admitted, they admitted 306 cases. The number that were unvaccinated came up, as you can see the chart, was about 261. Partially vaccinated was 39.8% fully vaccinated. So if you look at those who had mild disease, of those who are positive, you can see that fully vaccinated and partially vaccinated are accounted for about 60%. But if you then move on to those who were moderately ill, you can see that about 80%, 82% were unvaccinated. When it comes to severe, you have a similar number unvaccinated, about 80+% unvaccinated. And then those who were critical, about 98% of those who had critical condition were unvaccinated. So it shows you that the benefit of the vaccine is along the spectrum of the disease condition. Based on all these things, we've had some meetings, we've had further consultations, with ministers' approval, we have come up with a few more changes to our policy that we hope to enhance our fight against COVID. For international arrivals, the new guideline is that Ghanaians and resident foreigners who are partially vaccinated or unvaccinated are exempted from the requirement of full vaccination before traveling to Ghana. However, they'll be offered vaccination on arrival, and if they fail to take the vaccination offer, they go on mandatory quarantine for 7 days at their own cost. So what it means is that the issue of a Ghanaian being denied entry and a resident foreigner coming in because he's unvaccinated will be changed. But when you come in, you have to get vaccinated, failing which you take, you go a mandatory 7-day quarantine. The other cases will be considered case by case. Those who are sick and they cannot get vaccinated, we continue giving exemption for those who come up with those problems and are exempted. And to ensure that cases do not spread, we're going to enhance our home care management to ensure strict compliance with the home management protocols for all those who are eligible for admission. What it means is that we are currently doing some checklists to see those who test positive at the airport who can self-isolate. If you meet that criteria, you are allowed to go and vaccinate, isolate, but we are maintaining a strict program to make sure that you don't really break the quarantine or isolation policy. There's also the issue of de-isolation. Remember, we came up with the 14 days after WHO had given 10 days as the duration for de-isolation. We looked at our own local data and came up with 14 days. We've also looked at further international data. We looked at our own data. We actually tested people who tested positive along the spectrum, day 1, day 2, day 3, until we realized that a certain significant number of people had turned negative after a certain number of days following testing. So for that, all those who test positive and are managed at home will be de-isolated 7 days after testing positive. So which means that if you test positive today, you are not sick, you're just mildly sick, you are able to manage at home, within 7 days, you'll be able to return back to work because first, you are not infectious and you are also fit to work. I think this came up because there was also the change in policy, but of course, some people were also taking advantage of that. For all those who are hospitalized, not those who are in hospital, those who are hospitalized during the period after testing. Let's say you tested positive, you fell ill, you were detained, admitted for a day or two, and discharged, you de-isolate after 10 days, after testing positive. But for those who are still in hospital, that will be the responsibility of their doctor to discharge them and give them excuse duty based on how long they think they are fit to renew normal duties. For those who are high or moderate risk exposure to someone infected with COVID, that's another one. People were taking 2 weeks because he's a contact. If you stay home or self-quarantine for 5 days after the last exposure, that's the policy. So now you do 5 days at home. That is if you test negative, because we tested along the way, you stay 5 days. But if you do test positive, you go back 7 days, just like those who are exposed 7 days after you test positive, after the last exposure. So you were exposed, along the way, we tested you are positive. Your 7 days ends the 7 days from your last exposure to the person who had the issue, who was positive. The booster also policy has been approved, as was announced by the minister. We don't just look at it. We have a National Immunization Technical Advisory Committee who looks at international and local data and come up with the recommendations for ministers' approval. Based on that, booster will be offered to all health workers. Will be given booster, and the booster is 3 to 6 months after your last vaccination. So it means that if you had your last dose, say in March, you'll be eligible for a booster dose between 3 to 6 months, not immediately you've had that. And so that will affect all health workers, persons with underlying medical conditions such as diabetes, hypertension, persons 60 years and above, frontline security personnel, and members of the executive, judiciary, and legislature. It actually mirrors the initial prioritization that was done. Pregnant women who are unvaccinated will now be offered, can now be vaccinated. Previously, it was not policy to vaccinate them. Now they can be vaccinated. And they are recommending that we use either Moderna or Pfizer, which is the mRNA technology, to vaccinate them. The minister had mentioned areas of the mandate already. I think the group that still exists, as was mentioned earlier, is all health workers, students, secondary school, frontline security personnel, and commercial drivers. But I think further consultation is going on, and once the minister is convinced as to those who fall, the persons and the venues that will be chosen, and the date will start, that will be announced. But this is just to let you know these are the possibilities of people who are likely to be captured in the current mandate. So that will be after the consultation. The list may change or may shrink or may expand, depending on the situation as we find ourselves. Honorable Minister and friends, so our outlook is that our current fourth wave is being associated with significant increase in number of cases, and I think we're all aware around that. Despite the low proportion of severe and critical cases, evidence of high proportion of such cases are being unvaccinated is a source of concern. So what we have also noticed is that the numbers were high, but for the people who fell ill, who were mostly infected, were the people who were unvaccinated. The current downward trend is expected to continue with the intensification of efforts of maintaining protocols and vaccination. In Ghana, as soon as the numbers start rising, people start wearing their masks. I hope that they will continue wearing their masks even when the numbers are down, because you never know when it's going to start going up. So as the problem got bigger, people started wearing their masks, washing their hands, and avoiding crowds. It has helped us to do a very steep reduction. Let's keep it up. Additional measures implemented are likely to help drive the further cases down, like some of the airport policies, etc., will help us bring the cases further down. And we must all make concerted effort to ensure that the fourth wave is flattened by all the things we do, vaccination and adhering to the protocols. Thank you very much.